A very good afternoon to you all. I shall be discussing on the epidemiology of COVID-19. Whatever data I'll be presenting is what I've seen it from the websites of WHO, the CDC, the ICMR, and the Ministry of Health and Family Welfare. And this data is evolving, so whatever I have is what I have it from this morning. I should be talking about epidemiology. Most of about the viruses, Dr. Mansi has described. So what we have to know about epidemiology is about the agent, the host, and the environment. So I should be discussing the data, the world literature, as well as the Indian data, and from the state of Uttar Pradesh. Now coming to the chronology of the outbreak, on 31st December 2019, the WHO China country office was informed of a number of pneumonia cases of unknown cause in Wuhan city and Hubei province of China. On the 7th of January 2020, a novel coronavirus, which is now called the COVID-19, was isolated and identified as the causative agent of the virus by these Chinese authorities. By 31st of January 2020, the first case was reported from Kerala. In fact, 3 of the students had returned from Wuhan, China. Now looking at the early stages of the outbreak, the timeline, you can see that starting from the 30th of December 2019, and then we started having cases on in January, 1st January. The first case, in fact, was reported, as we all know, you know the timeline, but however, I'm just saying, then we had the second case they felt that it was an outbreak from a Hunan seafood market. And then we started having cases from January 7th, 11th, and then finally, by January 24, we had more than 835 cases from China. And look at the number of cases over time. You can see that the cases that have been infected or detected has exponentially increased over time. And until today morning, if you see the reporting countries or the territories from WHO data, overall more than 196 countries are affected, and the total confirmed cases are 375,498. This is till this morning, but I'm sure it would have changed. And the total number of deaths, 16,362. This is the distribution of COVID-19 cases as of yesterday, March 24, 2020. And you can see the number of cases, maximum as already described by our director, sir, that Europe, like in Spain, Italy, and United Kingdom, they're the most affected at present. Looking at the surveillance data from the WHO, you can see that you have almost 196 countries been affected. And if you see the Southeast Asia region, you can see Thailand, Indonesia, Sri Lanka, Bangladesh, Maldives, Bhutan, Myanmar had recently reported, Nepal, and Timor-Leste. And you can see that India has also seen the cases coming third in line in the list, 434. This is the data which has been published yesterday. The data keeps changing every day, every moment. So India, you can see, as of yesterday, 434 cases, confirmed cases, total new cases were 19, and the total deaths were 9, but we know that the deaths are 10 at present, and two new deaths they have shown that it was 2. Now look at the data of Government of India as of today. They have described 24,266 passengers were screened at the airport, of which active COVID-19 cases were 512, and those who were discharged or they got cured were around 41 of them, and 9 deaths, but we know that it is 10 at present. Looking at this diagram, you can see there's a sudden surge of COVID-19 infections which are detected over the last week. If you see from 18 to 24, can you see the diagram, the bar diagram, how rapidly it is increasing? So you know that there's a rapid transmission or infectiousness of this agent. Now looking at the different state-wise, state as well as district-wide infection or detected cases, you can see that a total of 25 states have been affected, both union territories as well as the states in India, and more than 103 districts have been affected. And if you look at Uttar Pradesh, 10 districts are affected, and you can see that Agra, cases are reported from Agra, Gautam Budh Nagar, from Ghaziabad, Kanpur, Lakhimpur Kheri, Lucknow, Moradabad, Pilibhit, Shimli, and Varanasi. And if you see that maximum cases of 8 were reported from Agra, Gautam Budh Nagar, and Lucknow. And the next in the cases, maximum cases were from Ghaziabad, 3 cases were reported, and the rest of the districts reported a single case. Now, this is the latest information we got this morning at 10 in the morning. This is an ICMR report, the SARS-CoV-2 testing status. So at present, we have more than 539 individuals that are confirmed according to the ICMR. Now coming to the agent, as she's already described, Dr. Mansi, very nicely, there are 7 human coronaviruses, alpha and beta, and of this alpha, the beta is the one which causes this COVID-19 belongs to the beta coronaviruses. She already described about it, who is at infection, everybody can get infected. Now looking at how it spreads, this novel coronavirus, COVID-19, it is usually spread from human to human. And we know by coughing and sneezing, that is by droplet infections. And as we know that you should not touch your hands, you should not touch the surfaces, continuously you should do hand hygiene, hand wash, which is very easy to do, or even using alcoholic hand rubs. Who are the risk groups? Extremes of age, those who are less than 5 years old, 5 years of age, or those over 65 years, or persons with comorbidities like cardiopulmonary problems like asthma, COPD, heart failure, as well as diabetes mellitus. Immunocompromised hosts, those who are who had undergone any transplantation, malignancy, or patients who are on steroid therapy. Healthcare workers, as we know, the doctors, the healthcare personnel, they are one of the greatest risk group. And any contact with a confirmed COVID-19 positive patient, a person can be infected. So it does not require that the patient is having symptoms. If the patient is in the early phase of his disease, he may not be symptomatic. So even he or she can spread the infection. Now we know that not only the human-to-human contact can spread infection, the droplets and fomites, that is very important. So besides the infected person, it can spread from, as this has already been described, so it is very important to stay that, already described by Sir, that social distancing should be done. Now coming to the basic reproductive, regarding this row, what is this? This is an epidemiological definition. This is an average number of secondary cases that are produced by one infected individual, introduced into a population of susceptible host or individuals, where an infected individual can acquire the disease, and the susceptible individuals who are healthy but can acquire the disease. If you look at this chart which I put up, see that the Spanish influenza, which was outbreak or an epidemic in 1918, you had maximum infectivity, whereas in novel coronaviruses, it is said to be around 2. What is the incubation period? She has already described 1 to 12.5. The median days is 5 to 6 days. And it is, as we get more, since research is going on, more data will be available regarding this. And the modes of transmission, as already described, droplets, as well as contact with fomites or an infected person. And transmission is usually human to human. Currently, there's no available treatment and vaccination, only support therapy and social distancing and social it is important that whatever they have, our Prime Minister has said, so that is very important. Thank you very much.